I'm taking BSI precautions. My scene is safe. The mechanism of injury is she fell off a ladder. There's one patient. I'm gonna request additional EMS support. Get ALS. Get an ambulance on the way. My general impression is that there is an unresponsive female teenager that has fell off a ladder. I am considering C-spine stabilization. I'm going to have one of my ghost EMTs hold manual stabilization of the spine while I begin my examination. Are you okay? Are you okay? She doesn't respond. I rubbed the sternum and pinched the ear. She didn't respond to the 3 stimuli, so she is considered unresponsive. I'm going to check her airway. Her airway is clear. I'm going to listen to her breathing. She's breathing regular, chest, and it's equal chest rise and fall. I'm now going to administer 15 liters per minute of oxygen via non-rebreather mask. I'm now going to assess the circulation, taking her pulse. Her pulse is strong and regular. Her skin is warm and pink. I'm going to check for major bleeding. There's no major bleeding. I will manage shock by conserving her heat and make sure that she has a blanket and elevate her feet. She is also a high priority patient, so we're gonna have transport be initiated immediately. I'm now going to begin my secondary assessment. So I'm palpating the cervical spine. There's no step-offs or deformities. I'm inspecting the scalp and ears, the eyes. The pupils are even, round, and reactive to light. I'm inspecting the mouth, the nose, the facial area. The trachea is midline, so there's no JVD. I'm palpitating the clavicles. Right now, I would have my one of my EMTs apply the appropriate cervical collar. Now I'm palpitating the chest. I'm inspecting and palpitating the abdomen. The pelvis is stable. There's no genital or perineal injuries noted. I'm going to inspect the right lower extremity and the left lower extremity. Point your toes for me. Push up. Not doing it. All right. Now I'm going to roll my patient onto a spine board without. Oh, you gotta do it the other side. I'm gonna roll her onto the spine board like this, and then I would slide the board under, immobilizer, making sure to have. Oh, I'm also gonna check the back while I'm here, making sure she's all okay. And then there's no issues. And then I would roll her onto the thing. And then now that she's on the board, we would move the patient to the ambulance. We would obtain the baselines and do sample history. And then you manage any secondary injuries and reassess every 5 minutes because she is a high priority patient. I'm done with this skill.